But again, there's a small population of patients for which the EEG recordings do not give any good information about where the seizure is. So this population of subjects then become candidates for electrodes that are implanted in their brain. These electrodes measure the electroencephalogram, so the sort of population activity, and using that EEG then, the neurosurgeon can see where the seizure is coming from. Now, we would like to have recordings that have better resolution than an EEG. Ideally, we'd like to have recordings where we can listen to the activity of individual neurons. And so together with Adam, we have teamed up to record the activity of individual brain cells in these patients. Now, as far as the patient's safety is concerned, we put our electrodes actually inside the EEG electrode. So here is the EEG electrode, and we feed our individual microwires through the EEG electrode, and they emerge at the tip. And these individual electrodes then come in contact with individual neurons whose activity we can record. This is an MRI of one of our early patients. This is a side view, and this is looking down. Here are the eyes. This just shows where the electrodes are in the brain. So you can see here the EEG contacts like this, and you can see this is actually the tip of this electrode, which is where our fine electrodes emerge, is in the hippocampus, and this electrode is actually in a neighboring structure called the amygdala. So now we have a situation, these subjects are in the operating room, they have the electrodes implanted, and then they go back to the hospital and they sit in their room and they wait for a seizure to happen, because we need to record seizures with the EEG in order to understand which brain area is giving rise to the seizure. So during that time, which can often be up to 2 weeks, they're in their hospital room, and that is when we do our recording, and they're actually very happy to have something to do while they're just sitting in the hospital room. And so what we do is to record from their brain while we have them do certain kinds of memory tasks. So we have a little laptop computer that we set in front of them. And the basic kind of task that we've done is a memory task where we show them pictures, and then we ask them with some time delay whether they remember seeing the pictures or not. So I'll just show you a kind of example where we would show them a series of pictures. And then with some time delay, usually 30 minutes or 24 hours, we'd show them the pictures again. And in that set of new pictures, there's some old pictures and some new pictures. Okay, so. Okay, I'm not going to ask if you remembered those. Okay, so during the learning phase, they are shown these pictures that are present on a screen, and then with some time, we do what's called the recognition phase. So this is the 30 minutes after. So they're presented a picture, and they're asked, have you seen this image before or not? Very simple task. But we have two things we measure. We can measure the subject's performance, how well they report that they remember, but we can also measure the activity of individual cells in the hippocampus. And in this first study, the one I'm going to describe to you, we asked some just very basic questions. So one really interesting thing that has never been seen before is whether you can find cells, individual cells, that show evidence for memory at the same time course as what we can see in humans. So when you do this kind of experiment, for example, in monkeys, you have to present the picture 1,000 times before you can be confident that the monkey has seen it. And so one special advantage of working with humans is that they can just tell us, I saw it or I didn't see it, with a single trial. So the first question we asked is whether there are neurons that can actually show us, are there neurons that change their activity from the first time that the subject saw the picture to the second second time the subject saw the picture, and we call these neurons familiarity detectors. So are they saying, yes, I saw that picture before? Another class of neurons that we sought to describe are neurons that would just be general novelty detectors. So they would be neurons that would fire most the first time the subject saw something. So these would be neurons that would fire upon presentation of the stimulus during the learning phase to all stimuli, more or less. And then these same neurons would be predicted to fire only to the distractor stimuli, the new stimuli that we added to confuse the subjects during the recognition phase. Now we know that for learning, and for many aspects of human behavior, detecting novelty is a very important feature. One needs to be able to make predictions about the stimuli in our environment that are actually responsible for the consequences that we experience. And so knowing that something is new is a very important feature of nervous systems. So we found actually evidence for both kinds of cells here, and I'll show you the first class here, familiarity detectors. So remember the task. During the recognition phase, they're shown some stimuli that they've seen before and other stimuli that they haven't seen before, just one time. These are the individual responses that we record from the neuron. And here are the different trials. So here are 12 stimuli. And this is during the recognition phase, and this is the response of this particular cell to the distractors, to the new stimuli, the stimuli that the subject did not see in the learning phase. And each one of these little tick marks here represents a response like this. We call it a spike or an action potential. So here, going up is the 1, 2, 3, up to 12 different stimuli. And this red bar indicates when the stimulus came on the computer screen. So you can see, let's say, look at the second stimulus here. The cell fired 1, 2, 3. The stimulus came on, didn't change much at all. Stimulus went off 1, 2, 3. So this cell is basically not at all responsive to stimuli it's seeing for the first time. Now we contrast that, look at that same cell, but now look at the trials where that cell, the subject is being presented with the stimuli it saw during the learning phase, and what we see is a dramatic difference. So the very same cell, and now here are the 12 trials where this is the second stimulus presentation. The stimulus goes on here, and so what you can see is that there's a dramatic change from the responses that you see before the stimulus to the response that you see when the stimulus is on the screen. So this is an example of a cell that has changed its properties just with one stimulus presentation. This is like a memory cell, we would say. We also saw the second population of cells, the novelty cells that I described. And these are cells then that fired only on the first presentation of the stimulus. So they fired to all 12 pictures during the learning phase. And during the recognition phase of the trial, they responded not to the old stimuli, but to the new stimuli. So here are the response properties, the average response properties of those novelty cells. And as I just said, they respond during the learning phase to all the stimuli. And during the recognition phase, they respond to just the distractors, the new stimuli. In contrast, the memory cells, or the familiarity cells, respond after just a single stimulus presentation with an increase in responsiveness, indicating that the cell remembers seeing that object. Now, one interesting thing that emerges from this simultaneous behavioral and electrophysiological analysis is that we can take advantage of the fact that subjects often make errors. Okay, so there are two kinds of error trials that a subject can make. There's one that's the false negative. So the subject saw the image, but they said, no, I haven't seen that before. Or a false positive. They never saw the image, but they said, yeah, I've seen that before. So we have the subject's response, but we also have the brain's response. So we can compare what does the brain do on these kinds of trials. And the way that we did this, I don't have time to explain, is to use modeling approaches that examine the amount of information content that's present in the firing